The line with me now is Professor Barbara Sahakian, who's a clinical neuropsychologist at the University of Cambridge, author of Bad Moves, How Decision-Making Goes Wrong and the Ethics of Smart Drugs, and a researcher on ADHD. Barbara, good evening to you.
Good evening, Clive.
Thank you for joining us. This rise in the use of drugs, first of all, does that surprise you at all?
Well, it's been underdiagnosed, I think, in the past, ADHD. I mean, if you talk to adults, and I guess you just gave an example of somebody who had to wait a very long time for a diagnosis. So I think that in many parts of the country, it wasn't really recognized before, and now people are more aware of it. The GPs and psychiatrists are more aware that ADHD exists. It is one of the most prevalent disorders, one of the most prevalent neuropsychiatric disorders of childhood. And I think the other important thing that most people don't recognize is about 50% or more of people who have it as a child also still have it as an adult.
Well, yes, this seems to be coming clear this evening. It's something I've learnt myself, I must say. What would you say to those who just say, well, we've always had hyperactive children, naughty school children. This is now just being designated as a disorder?
Well, really the diagnosis for ADHD is around the hyperactivity, the inattention, and the impulsive behavior, impulsivity. And that can actually be controlled and treated with drugs such as methylphenidate, Ritalin. Now, I don't advocate drug use for mild forms of the disorder, and certainly NICE also does not suggest that people should be using drugs to treat mild ADHD. But when it gets to the more severe end of the spectrum, if you don't treat, you end up with children dropping out of school. If they're adults, they get more job dismissal. They might end up in criminal activities. They certainly have more accidents. So these drugs are a very important part of the treatment, although they should be used also with psychological and psychosocial treatments and not just on their own.
Ritalin has had a bit of a bad press and has been criticised for being just a drug that you give children to try to control their behaviour and keep them quiet. Do you think any of that criticism is fair?
Well, I think, unfortunately, sometimes children are given too much of the drug, and that's not a good thing. But I think one thing I've done, I've looked at another drug, which is one of the classes of the smart drugs, although methylphenidate is a stimulant and modafinil is not. Modafinil actually improves task-related motivation, so it makes you more interested in doing the task, whether it be something that your teacher has set you at school, or perhaps studying for exams, or doing your taxes, or something like that. It makes you find that task more enjoyable and more interesting. So these drugs may also help in that sort of way.
And is it true then that some of these drugs that help you focus, there are students taking them to get them through their exams who don't necessarily have a condition, but it's like something, it's an improver to your performance?
Yes, that's right. I mean, you mentioned my book, and I point out there that there's this increasing lifestyle use of these smart drugs by healthy people. And in America, where they've done, really proper surveys that go through this survey methodology and are published in peer-reviewed journals, they've shown that, you can get anywhere between 16 to 20% of students on college campuses using these smart drugs to, enhance their performance at university.
Are there side effects to the use of these drugs, though?
Well, there are side effects. Fortunately, many people don't suffer the side effects. So, but if you certainly as students might do, where you take the drug and then as it's wearing off, you take it again and keep doing that, you might end up, not being able to sleep at night, which is bad because not only is sleep restorative, but you consolidate your memories in your sleep. So if you were trying to remember a lot of material for the exam, it would be counterproductive. And you can get cardiovascular side effects with these stimulant drugs, and obviously with anything that's a stimulant drug, there's a potential for abuse, substance abuse potential. Some of the other smart drugs like modafinil as yet, nobody has been able to demonstrate in experimental studies that there is substance abuse potential.
And is this affected in any way, or even caused partly by the kind of lifestyle that children have now? That, you know, the video games, the food that they eat. Is there any evidence that any of that surrounds them actually makes it worse?
Well, that's a very interesting question, because I've often wondered about that. These days, we usually have to divide our attention between, you know, mobile phones and computers, and we're talking to somebody at the same time. So we're really dividing our attention and sort of parallel doing different tasks. But, you know, when you try to focus your attention, then it becomes quite difficult, because focused attention is quite different from divided attention. So if you are trying to write a long essay or study for an exam or concentrate on something in particular, it becomes more difficult. So it may well be that these very short sound bites that we get in this activity where we, you know, multitask all the time may be, you know, promoting some of that problems with coming around to focusing our attention when we need to do that.
Well, it does feel a bit like it, doesn't it? I mean, our attention span generally seems to be much less, and there's plenty of research that seems to suggest that we don't focus on things for as long as we used to. So I can't imagine that's going to help things. If you've
that's right. That's right. But, you know, we have to be concerned about some of the ethical and societal issues to do with this practice of the increasing lifestyle use of these smart drugs by healthy people, not to mention the safety issues, you know.
And as an adult, we're increasingly seeing people diagnosed as adults with ADHD now. How serious a condition can it be? Can it really affect your life very badly?
Well, I have worked in a clinic with Dr. Ulrich Muller, who directs the clinic here at Addenbrooke's Hospital in Cambridge, and that's the clinic for adults with ADHD. And really, many of the patients, if they weren't treated with a drug, because they do have, you know, quite severe ADHD, they really wouldn't be able to hold down a job, because obviously you have to get to work on time. When you get to work, you have to focus on what it is you're to do, and then you have to organize your day. You have to plan and organize. And if you're not capable of doing that without the assistance of a drug treatment, then obviously you're at risk at losing your job.
Barbara, thank you very much indeed for joining us.